Welcome back, and in case you're just joining us, this is Good Morning Kenya. My name is Vivian Ndegwa, and right now we get into a different segment. Today being a Tuesday, we normally bring you health matters, and today is no different. Did you know that September is Blood Cancer Awareness Month? Well, yes it is, and for that reason we will be spreading awareness on this condition that is blood cancer. And joining me for that is a hematopathologist. His name is Dr. Kibet Shikuku, and he is the hematopathologist, the Nairobi West Hospital. Welcome to the show.
Thank you, Vivian.
It's a pleasure to have you on board to just spread awareness on this condition that is blood cancer. So we'll be checking on some of the causes, the effects, the symptoms, and the treatment options. So for us to begin, if we may just begin with a definition of what blood cancer exactly is.
Yeah, so thank you, Vivian. Let me start by saying that cancer in general is a terminology that we use to express or define abnormal proliferation of cells or multiplication of cells that should have ordinarily been normal. So when you get an abnormal multiplication of these cells, then we define that in a simplistic manner as cancer. Generally, we have different types of cancers. Or let me start by saying that when you see multiplication of cells, it does not necessarily translate to cancer, because when you look at growths in general, I usually, again using a layman's understanding, classify swellings into two. We have good swellings and bad swellings. So it's not always true that any cell, any swelling is an expression of an abnormality that amounts to cancer. You can get a swelling that medically is not a bad swelling, because we can take care of it. But when it comes to a bad swelling that then amounts to what we would call cancer, then that worries an individual. And so medically speaking, we say we have either malignant swellings or benign swellings. Benign swellings are swellings that can be taken care of. Once removed, you're as good as cured from that swelling. But when it comes to cancer, then that becomes a problem. So even with the blood, when you have an abnormal multiplication of cells that would have routinely been, growing and multiplying to certain numbers to help the body, the moment you lose that regulation, such that then you have an abnormal increase in number, abnormal functionality, then that amounts to cancer. Yeah.
So that is what cancer is in general, and specifically blood cancer. So what are the causes of blood cancer, or what are the risk factors involved?
Yeah, so I think it is just good for us to very quickly then say what are the various types of cancers, blood cancers, that we can talk about, because then that in a way, determines possible causes.
Okay.
So generally when we look at blood cancers, we talk about 3 to 4 major types. We have what we call leukemias, and I know that is what majority of the people have always associated blood cancers with.
Yeah.
The moment you hear someone saying you have blood cancer, the immediate assumption is that it must be a leukemia. But we will talk about leukemias. The other one is we also have cancers that tend to affect cells that have either matured a little to the extent that you would expect them to be functioning normally, because you can either have cancers arising from relatively young cells, but you can also get cancers from mature cells. So the young cells would tend to be associated more with the leukemias. Then you have slightly more mature cells that can cause problems as far as blood is concerned. Those ones fall under the myeloma, multiple myeloma in particular. Then we also have cancers that affect organs, certain structures in the body, like the lymph nodes. Those fall under lymphomas. And so those are the 3 major categories that we tend to talk about when we are looking at blood cancers. And when you look at cancers in general, I think it suffices for me to say that cancers are not a function of one problem. It's actually a multiplication of various factors.
Yeah.
So the first usually is some people are genetically exposed. So you are born with the genes that, exposes you to easy, cancerous processes or cancer development. The other one is, and again, it's not sufficient for me to just say genetics alone, but then it will be genetics plus a few other things that I'll mention. The first is the environment that we get exposed to. So look at an environment that is polluted, with chemicals. So those chemicals in the presence of this genetic exposure can tip one into early development of cancer. And our environments are generally exposed to various chemicals. I think the other day Kenyans were being shocked that our sugar, for example, had mercury, and Kenyans went into some very serious, people are a bit, in fear that could potentially cause cancer. So chemicals, and I've just used mercury as an example. Of course, there are many other chemicals in the environment that can be a problem, including the herbicides, the pesticides that we use. So basically chemicals in general is a big predisposition to cancer development. The next one are infections. Remember, we have cancers that we have tended to associate with cancer development. For example, I talked about lymphomas. So there are certain, infections that have been associated with certain cancers. I know women are usually told if you get HPV and you should be vaccinated against HPV, those are viruses. So there are certain viruses that, would potentially cause cancer. The other one is radiation. So if you have exposures to, various causes of radiation, including, I think, the other day when we had a vehicle, I think a lorry that was, a tanker that was transporting some radioactive material. And, obviously, that again became an exposure. We've heard about the Hiroshima, bombs that have caused a lot of cancers in Japan. So again, radiation is a key component to blood cancer development. And, so if you look at what the environment exposes you to, I talked about, the chemicals that we talk about, and I know that is where usually the biggest headache usually lies, plus all these other things that we've talked about, potentially then makes you prone to cancer development. But we also have cancers that tend to occur early in life. That's why children get cancers. And then the others may be associated now with the environment, and those ones would come a little later in life.
I just want you to clarify this. Sometimes it is said that, the use of microwaves to warm food causes cancer. Is that true?
Well,
is it medically proven?
I don't think I would have any specific explanation to say it is medically proven, yes or no. I know people have had various explanations on exposures to various, rays, including the use of earphones, our phones. So there's a lot actually that has been, should I say, people are still investigating to see whether there have any direct causation to cancer. Some may potentially, possibly, exponentially make it worse and easier for cancers to arise, but data is still being collected to see whether this actually has been associated with specific outcomes. Because
we also have ladies being warned against, when we go do our manicures and our pedicures, there's some machine where we put our hands for the nail polish to, so we're also told that could cause cancer. So these are not really medically or scientifically proven just yet.
Yeah, so I know, these are things that are still under investigations. Some may actually be associated with certain cancers, just like we have some beautification products that have been associated with certain problems in the body. So again, these are things that we all have to, start looking into and trying to see how much of these exposures can actually cause cancer, or what other medical problems would be associated with exposures to some of the various normal routine practices that we think are appropriate. Yet at the end of the day, you get exposed to an outcome that you may not be able to explain. We know that there are certain rays that can cause skin cancer. So it is a question of the concentration, and the level of stimulation of the cells that can then lead to an abnormal outcome. So again, someone has to look into those processes and see how much exposure is sufficient and how much exposure is a risk, to causation of cancer.
Okay.
Yeah.
Well explained. So what are some of the tests that are involved in diagnosing blood cancer?
Yeah, so generally, the moment someone has an abnormal multiplication of a cell, so I want us very simplistically just try and see where these cells are produced. So majority of our blood cells are produced in the bone marrow. And if you have an abnormal production of cells from the factory, naturally if you have excesses in terms of production in a factory, that factory then gets overwhelmed with the product. So you have a marrow that is heavily infiltrated with abnormal cells, because these cells are producing large numbers of cells that are not normal. The same cells are not regulated. So basically you overwhelm the marrow with abnormal cells. And by extension then, what would happen is that you have other cells being displaced. So remember, from our biology, we know that there are three major types of cells, blood cells. You have the red blood cells, you have the white blood cells, and you have the platelets. Okay, and these are used for clotting. So when you have an abnormal cell, if the white blood cells, for example, are the abnormal ones, then their rate of production is at high levels such that they displace the red blood cells and the platelets. So by extension, if someone was to see these cells, because now these cells will be produced in large numbers, they'll accumulate in the marrow, and then they are released into circulation. Okay, so you have abnormal cells that are now circulating within your blood vessels. Okay, so even if we just took your blood from your blood vessel, we can actually be able to see these abnormal cells circulating in your blood. And generally when we start looking at investigations, we start by looking at blood. So we take your blood and we look at what those parameters look like. So one thing that would be so obvious is that the normal routine numbers that we are used to medically will have changed. So you are either seeing excesses in one line and a reduction in the rest of the lines. Because as I did explain, you have a cell that is literally overburdening the other cells, and so their numbers would automatically reduce. So if it is an abnormal white blood cell that is affected, you'll see those white blood cells being released in large numbers. And so the moment a doctor or a clinician sees abnormal numbers, then if it is a white blood cell that is excessively increased, the first assumption is, are you having or expressing an infection, or are you having some cancerous process? Okay, so the blood findings, just by looking at the cell counts, would actually possibly give you an indication that something is not okay. The next thing you want to do is to confirm that these cells are truly abnormal. And so how do we confirm that? And this again gives us the reasons why we have different specialties in medicine. So if a lab technologist, for example, just picks blood and finds an elevated, or abnormal counts, then they'll do what we call a smear. You can actually do or express these cells on a glass slide, and you prepare in a manner that then a pathologist would be able to look at these cells on a microscope, and they can be able to deduce which cell is abnormal and then determine the type of abnormality. Okay, so that is the next phase. The other phase now is to go to the factory itself and see how much of these cells are actually abnormal. in the marrow itself. And you can then do that by doing what we call a bone marrow aspirate. You actually literally go to the marrow, you aspirate that marrow, and you can be able to see the abnormalities in the marrow. The other tests that we sometimes engage are a bit aggressive. They are not routinely done, but we still do them. We can actually get a biopsy of the bone. So we do what we call a trephine biopsy. So you can go into the marrow and you get a small core of the marrow, and you can be able to subject that to processing, investigate and see which cell is abnormal.
Okay.
Then again, as I said, some tests are, again, not done here, but we tend to engage various laboratories, both internally and externally, and that is looking at the genes. So you can do genetic tests. You see which genes are affected, so you can be able to deduce the mutations associated with that particular malignancy. So these are the basic tests that we can be able to do just to determine presence or absence of cancer.
Cancer. All right. So what are some of the very early signs of blood cancer?
Okay. So again, this is heavily dependent again on the type of cancer, but overall, what are the things that you would see? So, as I did mention, that there are 3 types of blood cells.
Yeah.
And if you have cancer involving the white blood cells being produced in large numbers, thrown into circulation, these are abnormal cells in the first place. The first question is, what is the role of a white blood cell in the body? White blood cells are supposed to protect you. They are supposed to produce antibodies against, some intruder. They are supposed to fight for you. But now you have an abnormal cell. It's like getting a human being who should be helping you, but they have gone mad. I don't know how much help you would get from such an individual. Not that madness is, of course we know that, someone who is not in their rightful state may not be of value to you. So you have a cell in large numbers that is useless. So those cells then expose you to infections. So a lot of times patients will come with some underlying infection. They have fevers, high fevers, so because their bodies cannot be able to manage infections, or they are producing chemicals that actually make your fevers rise. These patients can easily bleed. So you have a patient that, they want to pass their stool, there's blood in the stool, there may be blood in the urine, they want to brush their teeth, things are not okay. They might even end up coughing out blood. So the easiness to just lose blood sets in. The other one is, your red cells are supposed to be carrying oxygen in the body, okay? And they're reduced in number. So you can imagine how much exertion or how much fatigue, how much you will be unable to function. You are tired. You can't function normally. You're weak because your body cannot be able to do the routines. Your red blood cells have gone down, so you can't sufficiently oxygenate your cells. So you get tired. The other one is because of these large numbers of cells in circulation, what would happen is that your blood becomes heavy. So medically we say the viscosity is high. So your flow rate, your speed of blood flow gets retarded. So you can easily form clots, okay? Then the other one obviously now is dependent on the organs, okay? So some organs get enlarged. The liver, which is usually on this side, tends to enlarge. The spleen gets enlarged. The lymph nodes, okay? You also start enlarging. So basically you start seeing organs, changing. So basically these are just basic, expressions that we tend to see in patients. And so anybody who's, seeing these signs, you have a child who is being treated for infections, purportedly, being exposed to infections, not getting well. then you should start suspecting that things are not okay. You start seeing swellings in different parts of the body. Again, that should be worrisome. Yeah.
So what we're encouraging mainly is early screening. Just go do the screenings, because sometimes when you get to see the symptoms, it may be a bit later on. It might have really progressed. So you're advising for screenings.
So I think for me, crucial is that do not underestimate any abnormal expression. You are seeing fevers that are persistent. Don't just assume that because a child is playing or because you are still able to function normally, you keep pushing. No, just go and check. In fact, we have this type of cancer that affects the slightly older folks. Multiple myeloma. It comes with the joint pains. Okay, you have your joints paining. It comes with fever. Sometimes you fall down and you end up fracturing. You have a broken, you have a broken bone. And so people tend to rush to the orthopedic surgeon because now it needs to be repaired. And they say, oh, I slipped and broke my bone. Only to realize that it is actually cancer in the bone that has eaten into the bone and made the bone very fragile. Okay? So, and that is how we diagnose some cancers. So really, when you see something abnormal, do not just look down upon it. Try to seek further, explanations to those kind of things. I've seen individuals who would come, having consistent and persistent fevers that are unresolved. They have used all types of antibiotics. They have visited one doctor to the other, and nothing is changing. So do not overlook. Do not keep moving from one end to the other, but at least try to see what else could it be. And it's not always true that cancer affects the elderly. Cancer affects the entire span. Okay? So don't think you're too young not to be checked, just in case cancer is a problem.
Can cancer be asymptomatic?
Can it be asymptomatic? I think it is just dependent on the phase at which your body starts saying, sorry, I'm unable to function. So yes, we could indirectly say so, but then a lot of times you'll start seeing something that is not normal, and that should be a sign for you to start seeking care.
All right. What determines the progression of cancer? Because we know of the stages, there's stage 1, stage 2, stage 3, stage 4. So what determines this progression?
So Vivian, I'll be very careful with what I'm going to say.
Okay.
Now, the stages are heavily dependent on the type of cancer. Blood. So let's see. If you have a swelling somewhere, you can stage it because that is a swelling in a specific spot, in a specific area in the body. You can stage that. So you can say this is stage 1, this is stage 2, this is stage 3, depending on how far that cancer has gone. If you're talking about blood, tell me one part of the body that will not have blood.
None.
So we don't stage blood cancers.
Okay.
We tend to say blood cancer is a systemic disease. It's a disease that moves everywhere. So you have blood literally moving around. Okay, so again, when it comes to blood cancer, it is a systemic disease. It's a disease that is literally circulating in every part of the body. The question is, what do we need to do, as soon as we determine that cancer is there? And I think that now brings us to various approaches to manage blood cancers. But it is also true to say that depending on the type of cancer that you're dealing with, you could have, for example, if you have cancers involving the lymph nodes, you can actually find certain lymph nodes affected. Okay? And you can be able to determine which of those nodes are actually affected. If it is multiple myeloma, for example, that tends to affect the bone and expresses itself through challenges in the bone, you can also get, this kind of swellings in certain specific areas. we call them solitary. So, but then, you know, the moment it starts getting into circulation, then it ceases being, you know, in a specific resident in a specific area. It starts moving in, you know, to other parts of the body.
All right, on that note, we'll take a break, but we'll be back to continue with this conversation, so don't you go too far. Welcome back to Good Morning Kenya. The segment on air is Health Tuesday, and we are having a discussion on blood cancer. And with me is Dr. Kibet Shikuku. Now, Dr. Kibet, we've looked at the causes, you know, we've looked at what it does to someone's body. And right now I feel it's time for us to look at the treatment options. But before we get into the treatment options, what should I do? Or what should the person who's sitting at home who does not have this condition do in order to try and reduce the risk of developing it?
Yeah, so thank you, Vivian. So for those of us, you know, who are seated wherever we are, you know, feeling like we are okay, you know, we are not exposed, I think the right thing to do is to continue ensuring that the environment we are in is good enough to, you know, avoid exposing us to different types of cancers, as I did mention. And that's why, you know, a healthy lifestyle is what we tend to recommend. You'll see various adverts saying, you know, do not use this kind of pesticide, do not use this kind of herbicide, avoid exposure to radiation, you know, do not get this kind of infection. So basically these are things that as a country and as a people we should attempt as much as possible to do. Let's feed well. Let's ensure our bodies are sufficiently catered for. This way, you know, you are supporting your cells to perform optimally, you know, in a manner that then allows you to function. So I think that is crucial because when we avoid some of the exposures that I did mention, then we can be able to sufficiently say, yes, we are okay. If you think you come from a family that genetically is exposed, then the right thing to do is to keep going for medical, you know, screening, be assessed, you know, let someone examine you. That's why people go for medical checkups. And I'm not trying to say this, you know, to support what the government is trying to do, but I think it is also important for us to say that through the Social Health Authority, SHA, that is now, you know, on board, there is an element on screening. And I think now Kenyans have an opportunity to go and get screened. You know, when SHA is able to function and run, people should go for screening. You know, there are age groups that you should go for screening. But routinely, go for screening. Let's see what is going on. Maybe
as you're on that, why is it that we don't have a culture of checkups? You know, as Kenyans, we don't really have a culture of going for checkups. You know, the only time I'll go to the hospital, I'm also speaking for myself. The only time I'll go to the hospital is when I'm not feeling well. But I can't just wake up and say, let me go get checked.
I think it is a combination of things. One is knowledge. You know, knowledge is power. When you understand, then you can be able to seek, you know, whatever kind of information that may be of relevance to you. So I think a lot of our people are not informed. The other one is stigma. Let me tell you, a lot of Kenyans will tell you, if, you know, for whatever I don't know, let me not know.
What you don't know won't kill you,
exactly.
they say.
And that is usually where the risk lies. Why don't you just be checked? If something can be averted, let's stop it. So the challenge usually is that people tell you, oh, let me not know. In fact, even when HIV came, people said, oh, I don't want to be tested. I don't want to know. Okay? And again, you know, it's just, you know, this fear of the unknown. I think when we start now looking at interventions, then Kenyans can realize, or people can generally know, that when you get picked early, a lot can be done early, and you can actually save an outcome that would have been ominous by putting certain interventions that can then make us live well and live better. So that culture needs to possibly change so that you know, Kenyans can routinely start going for checkups. And if something is amiss, as I did mention, then we can do an early intervention. So let us not be in fear.
The earlier the better.
Let us not stigmatize you know, certain diseases, because I know the moment someone hears I have, you know, leukemia, I have blood cancer, it is death sentence to them. That may not be true. We have a good number of Kenyans that have been cured from these cancers just because, you know, this was picked early. And again, as I did mention, care has improved. I know initially what used to happen was that we didn't have capacity to diagnose. In fact, people are saying, why are there too many cancers? I think there are various explanations, including improved capabilities to screen. Now I can screen you. We know, oh, you have cancer, we refer you for care. Previously, you would just die at home, you know, and guys would dispose you. But lately, when something is not okay, you can be screened, people can know this is cancer, then treatment begins. So again, you know, technology changing, improved healthcare, and these are things that we should take advantage of and you know, just be screened. Yeah.
So we've looked at ways to avoid developing these cancers, but I'm sure there has to be someone who's watching us right now. Probably they have this condition or they know someone who is already infected by blood cancer. So as we mentioned, it's not a death sentence. So what are the treatment options available for that person?
Yeah, so let me just start by saying that we have various modalities that we could apply to treat cancer. Again, you know, as I started off, I said cancer is basically abnormal multiplication of cells. So naturally, the way God has designed things is such that if you have something that is triggering an abnormal multiplication, you can get something to counter it. So we have drugs that fall under, you know, the broader category of chemotherapy, and chemotherapeutic drugs are drugs that we use to treat cancers. And so these drugs have the capacity to disrupt multiplication at various, you know, points. And so science has allowed us to design these drugs. Okay, so some drugs would tend to act at a certain phase of multiplication, while others would break certain parts of you know, the multiplication cycle. And so these chemotherapeutic drugs that we get have various challenges as well. Because remember, a multiplying cell, okay, could be normal or abnormal. I'll repeat that. A multiplying cell could be normal or abnormal. And when these drugs come to function, they can distinguish an abnormal multiplying cell and a normal multiplying cell. And so when you use these chemotherapeutic drugs, they'll target any multiplying cell. That's why when you have cancer and you're on chemotherapy, your hair falls off, your skin changes, you have problems with your, you know, your intestinal, the gastrointestinal system. You have problems with areas that cells are still multiplying, okay? Because chemotherapy does not necessarily distinguish the two, but they can target, you know, to a larger extent, the abnormal multiplying cells. So that is one modality, use of chemotherapy. The next one is to try and use certain agents that specifically target these cells, either to destroy them. You've heard of drugs falling under what we call immunotherapy drugs. So you use someone's immune system to either destroy, okay, or to retard multiplication. Okay, we call those immunotherapy drugs. Then we can also use radiation. So you can target to specifically send radiotherapy to specific areas. So if, let's take for example, you have a swelling, okay, involving an organ or involving certain parts of the body, you can radiate those areas, you can burn those cells. Okay, so radiotherapy has always been used. The other one is you can also use, and also just coming back to immunotherapy, is that you can use certain, you know, agents that specifically target, you know, we have targeted therapy. So you can target specific aspects of the cell using an agent that specifically targets certain parts of the of this abnormal cell, and that can also help. But before I get too far, technology has also allowed us to use what we call bone marrow transplant. Okay? I can literally go to the marrow, okay, stimulate that marrow, to give me young cells. Those young cells are what we call stem cells. So I can basically go to the marrow, and I'll talk about this if time allows. But I can go to the marrow, stimulate the marrow to give me young cells, which I can harvest. So using technology, I can actually stimulate the marrow, I get these stem cells in circulation, then harvest those stem cells using a machine and keep them somewhere. Okay? And I get back to your body and literally destroy your body using drugs.
Okay.
Okay? I wipe you off any cell that I think is abnormal. Once you are sterilized, okay, then I can retransplant these stem cells into you.
Body.
That is in case your disease allows us to harvest your stem cells.
Okay.
If we are unable to harvest your stem cells because we think they might still be carrying abnormal cells, we then can harvest from someone else, keep them somewhere, destroy what you have, and retransplant these cells in you. That is the concept around bone marrow transplantation. So we destroy what is within you, then we give you new cells that will regenerate and now give you, you know, something new. You're as good as being reborn again. Okay? And that's why with bone marrow transplants, we are able to function. And as a country, these are things that we have.
We do that in Kenya?
Yes, we do bone marrow transplants in the Nairobi West Hospital.
Oh, okay.
The first and still so far the only facility that is able to provide bone marrow transplantation. But as if that is not enough, we also have gene therapy that is now coming on board. So people are using genes, manipulating cells, and they can be able to, you know, reintroduce those cells into the body, and you can be able to manage an individual. So all these are possibilities that we have. One thing that is of importance is that different cancers may require different combinations. So there are scenarios you can do chemotherapy and radiotherapy. You can do chemotherapy, radio, and bone marrow transplants. Question is, what is the best? I guess all of us are looking for ways to cure cancer. And we know that for some cancers, bone marrow transplants have given them longer survivals than just the routines. Okay? The routine chemo, radio, or monotherapy or immunotherapy with something else. So yes, all these are possibilities that we have. And I think as a country, we should be investing more in technology so that even when it comes to radiotherapy, we are using safer radiotherapy methods. Because just to help the general public understand, when you are radiating an area, I can push rays in a certain direction. So let us assume I'm targeting a swelling in the breast. I can send rays this way. Those rays will burn both the abnormal cells and the normal cells. But we also have technology that allows you to just burn the swelling itself. Precise and accurate radiotherapy technology, okay? Which again as a country we have, okay? And these are things that we should be investing in as a country to improve care and minimize complications.
Okay, we're almost out of time, but just before we get to wind up, are there any promising findings on the research on cancer? Are we foreseeing a future whereby cancer won't be an issue? You know, like the way we have HPV, which is the vaccination that can help you. It's a vaccination against uterine cancer, right?
Cervical.
Yeah, cervical cancer. So is it promising? How is the future looking, matters cancer, in terms of the findings on the researches that you do as doctors?
So I think there are a lot of promising outcomes because cancer management is taking different dimensions. As I did mention, people are refining ways of managing cancer, including, just as I mentioned, using targeted therapies. You don't want, drugs that can destroy everything and anything. You know, you want to use specific targeted, treatment products. Even when you're doing radiation therapy that I did mention, you don't want to just radiate and kill everything and anything. You want to use precise, accurate mechanisms. Even as I talked about transplants, I've also talked about gene therapy. Lately, people can downstage, some cancer. So yes, there are promising, should I say, findings and research that is ongoing. In fact, the other day, I was discussing with a group, from Germany, and what they are doing right now for pancreatic cancer is to use heat as a modality for treatment. So you actually put in a casing, and you are subjected to some amount of heat for some amount of time, and that, in a manner, ends up destroying, cells within the pancreas, and that helps us to cure pancreatic cancer. But again, this is under development. We think it may be better because certain cancers have bad outcomes with certain aspects of treatment. So yes, technology is advancing. We hope that we get to a level where you just swallow a pill and this looks for anything that is abnormal, and you should be able to get better.
We really hope
But as I said
days.
again, this is heavily dependent on what we invest as far as research is concerned.
All right. Thank you so very much, Doc, for gracing our show and for shedding light on blood cancer. And as we mentioned at the beginning of the show, September is Blood Cancer Awareness Month. So it was only right for us to bring the awareness on blood cancer. And Doc, you've done that very well. So thank you for that.
Thank you.
All right, this is where we end Good Morning Kenya for today. Thank you so much to each and every one of you who has been tuned in. My name is Vivian Ndegwa. Until next time, God willing, I'll see you then. And right now, I want to leave you with the weather updates. Goodbye.